Hey, it's Steve, and welcome to another deep dive review in surgical robotics. This week I was able to get down to the SECO meeting at the Gemelli Hospital in Rome, and Hinotori was there with Medicaroid. The Medicaroid team were there with Hinotori, and I had a chance to be with the team there. And on my last video, people were saying I would like a much deeper review of the technology, not just the blah, blah, blah around the companies or whatever. So this time I've done a super deep technical review of the Hinotori. And Sebastian, the trainer who I used to work with a couple of years ago, was there, and he's taken us through every single detail of the Medicaroid Hinotori. So this is a deep dive video, and I'm going to let it be self-explanatory. And then at the end of it, I'm going to explain to you in details my thoughts on the Hinotori system from Japan, from Medicaroid, which is Kawasaki and Sysmex. And I'm going to give you a deep my thoughts on that system, and what I really think of the system, what I saw there. Interesting. So get on with the review. Go through the whole review. It's about 40 minutes, but it will give you every detail about this system. So for the techno nerds out there like me, you should really enjoy this. And Sebastian did a great job. So dive in, enjoy that, and then wait till the end, and I'll give you my thoughts and review.
So for first, I need to switch on the Starts monitor, because all devices, if we want to reboot them simultaneously in the interlink mode, the all devices needs to have power.
Yeah.
Yeah. And as I promised you, I do it now here.
Yep.
A short press, you hear it. It's blinking. So orange blinking means power up. So we start. So you will see the starting sequence on this screen, and you will see the starting sequence also on the surgeon cockpit. So, and accordingly, what is the next step? There will be a self-test, like calibration.
Yep.
Yeah? So let's wait for it. It's asking you. So I tap on yes, and now come around. Here, all the joints, the brakes, all the kinds, for first the arms will be tested with a self-test. So you will see the arm base is moving, you hear this snatching, these are the brakes of the system, that everything is not just pulling down. Simultaneously, here, the hand controller, we didn't see it, they moved up, oh you see it, they moved up a little bit more into the side, there will be a snatching, everything will be tested simultaneously. Yeah. So it shows you the percentage of testing. If it fails, it will re-ask you to re-perform the self-test. Before the self-test, as usual, is not performed, we can't go into the next modes. You see the hand control are going down, so all the movements are simulated. Here you see the arm controller. They are just inserting and removing. The arm base is moving all the wrist. So this is a very impressive, obvious self-test of the system. So the snatching of the hand controller they were here. And at last you hear again the internal brakes of the arms. Fantastic. So 96%, almost done. And then you need to confirm that you want to continue. 100% successfully. And we can start.
Yep.
So draping, theoretically we could go on standby. On standby for different reasons. Anesthesiologist, narcosis, or some time delay needs to be discussed. It's putting together, reduces the footprint.
Okay.
For ready to cover it with a sterile cloth.
Got it.
Yes? Okay. So theoretically, I will show you how to drape, because these are the drape.
Would be sterile.
The old one. These are the old one. We have newer one, which don't have this one. So the drape is over here. This is the drape adapter as a drape cup.
Okay.
And with a drape cup insert.
Is this single use?
Single use. Absolutely single use, because it went sterile. So wait a minute. It looks like this.
Okay.
It looks like this.
Yep.
Yeah. So, okay, let us just pretend that we want to drape. So I will show you a drape procedure. Good. So my colleague already, so let's pretend I'm the circulating nurse for first. I will approach my height. So you see here is the end of the joint, so end of the limit is reached. But I can go higher in that case, and also here is the end of reach. So I need to go to adapt it a little bit. Good. So my colleague or me, as I'm circulating, I will just put everything into space that I just don't contaminate anything. So let us pretend this is a sterile table. So we have the drape is for the operation arm, yeah? So as usual, we control the exceeded of life, no damages, and then we remove it. So you have here a cover, which is showing you front. Front belongs to here. We also see the cover for the arm controller connection port. Here is the top, which has an elasticated collar. I prepare it, that it's, and I always say it, related to my previous job, make it puffy and very relaxed, so that it can fit. You put it inside, so you like this. Even when you contaminate, it's the inside, so nothing happens. Then we just move it inside, just down here over this. And here are protectors with that my gloves can't be contaminated even when I'm just touching something. So you see that it's still protecting my sterility. And now again, it's always the same, make it puffy, make no tension, and that it fits here. So this is the new drape, where we don't need these plastic caps. So I remind, okay, good. Now let's pretend that we all drape the arms. We just remove this kind of cover and pay attention, because now you have your unsterile surface, and we need
a sterile.
Yes, absolutely. So let's take one. So here is the sterile drape adapter. The drape adapter is here. Good. Drape adapter protector, which is protecting the inlet, the connection port of the instrument housing. You just put it inside. There's a lever, a white lever, which needs to be pulled, because otherwise you have no connection port connectivity in that case. So you pull it up, and then you see everything is in neutral position, and you just put it on, you hear it, put it down, and it's done and ready for use. A draping detection.
Got it.
Yeah, but nothing happens because nothing is attached. Even when I'm doing the protector, when I'm just putting it on and doing this, you see how it's snatching. It says, no, I can't do it on neutral position. So the draping fitting is not sufficient. So once I need the drape protector, so I just put it on, yeah. Tongue is pulled, because otherwise you see the white line, and then I connect it, put it on, and I have my draping fixture.
The happy
so
sound.
Yes, the happy sound. Yes, the happy sound. You're right, absolutely. So this is, and once we have draped this one, we can.
Nice.
Yeah. So this is how it functions to drape. So we also have the arm base drape, where you can just do it with a unsterile person, because the endings are just covered above, and it's in the protocol. Yes.
One question: do you have to drape all four arms for it to work?
Yes.
Okay.
Absolutely.
So you need four connectors and four to make it work.
Yes, absolutely. So once the sterile nurse is scrubbed, she will do this. So it's less than 5 minutes.
Yeah, it looks a very fast draping.
It's a very fast. So experienced Japanese medical staff, from the setup to the surgery, go 25 minutes, maximum 30 minutes. So one, I heard about 20 minutes, but 25 is the moderate time. Yeah. So it's an easy approach, because once I have just done this, my circulating nurse can put everything inside. Yeah?
Yep.
Okay, good. Yeah. So, but let's do the anatomy. Okay. The approach. Patient is on the right side, so we approach patient left. Yes, could do patient right also. And then we have the anatomy. So thoracic, upper GI, kidney, pelvic, and lower abdomen for colorectal. So we choose the pelvic approach. So here, if you would be now left hand, we have here the subhand and the actively, but your right hand. So we have this approach with subhand on 4 and actively working instruments. So we have the adjustment now, and the next one, the green obvious button, is to roll in. We can't roll in with this kind of footprint because it's a frontal thing. We could hit everything, and it's not the longitudinal approach.
Yep.
So it's shown to the floor. So we need to change the shape by pressing, and I'm just doing something. Oh, safety feature. It says it's the wrong word. We need for first the blue button, the enable button, and then press it to proceed. You see it's folding, reducing the footprint, and it's turning into the target anatomy. Because we said patient approach from the left, that means the arm controller are going directly to the target anatomy.
What if somebody's not seeing the bed or something and it now touches the bed?
I'm sorry?
If it suddenly touches the bed or something,
So it means like a hit or something. So the system is realizing that somebody is getting hit. If this force is very intensively, you will have a response in that case.
And it will stop.
But it's not, but it's not so forcive like that it just pushes you away.
Okay.
So it's also, when I work with first assists, so it's on level 1. I could even go down because of the ceiling, but it's okay. So now we have the approach. I didn't confirm that we have the V shape. The camera needs to be visible, that we know, okay, where do we want to go? We need the camera, and we need a reference point, because do I have to go left, right? I don't know. But if we face the entrance of the endoscope port,
Okay.
this is our target, because this is always the reference point. We do the pivot point setting with the endoscope also. So this is going like a dart plane. Yes, absolutely. You see, so when I say I accept the position, the screen turns into a floor recognition, and it's like a dart plane.
Okay.
When I'm here doing nothing is happening, because I need the throttle now. Use the throttle and use the blue button, which is called drive switch, not enable button. So, and now you see I have a guidance.
Okay, the park assist.
Yes, the park assist. So I can go like this, or I can just go like that. Yeah, so this is something where you, with the 3 wheels, it's so easy to approach because you have so smooth maneuvers or movements, like, and the card doesn't need to be parallel to the table.
Oh, okay.
I'm talking about slightly angulation.
Yes.
Yes, not about 45 degrees, because then you change your setting in that case when
But it
the
doesn't need to be perfect.
Absolutely. This is something where we just bridge. Yeah, so if I'm going backwards, I try to save the cable. Cable management is everything. So you see, it's on 3. So we just approach it, and I will show you now the second. This is my trainings approach for the nurses. So I'm moving, and my target is there. But if I'm, Steve, I'm half Polish and half German. This means compulsive, obsessive, obvious, open behavior. I say, okay, let's do a 200 zoom. A 400, yes, I'm matching. I'm on the port, so I'm happy. But matching the port doesn't mean exactly in this inside, because I told you about the range of motion is impressive of the operation unit. So, good. Then we need to talk about these automatic angulation. We have some recommendation and references. So we say, okay, because it's an arc shape, if we go to the arm base, do you agree that the arm base direction is not really aligned with this arc port placement?
Yes.
You know that I need to adapt it a little bit to my arc shape.
Right.
So for this, Mark, I need you please. Yeah. For this, I will face, come here on this side, please. Thank you so much. Port 1 and port 4, and I make alignments so that the dear Marco is holding it, that you can see it obviously, because normally you can do it without. Here, now come around. Put your face a little bit more to this, so alignment to this, both fantastic. You see these both ports, and now we need to do a parallel matching to this, and then the arm base turns into the target anatomy, which make it very smooth. I just for obviously reasons. So you use the enable button again, and rotation, twisting, and you see that it's using more parallel. So you see here. So this is parallel.
Yes, got it.
And then we remove it. Next thing is, do you agree when thank you so much. When I'm just having this shape, yeah, I'm working more into the dorsal area. But if I am the arm base and move forward, I have more reach and, for example, endopelvic fascia, and to go to the ratio space to release everything. That is, you just put your reach more into.
So you want more tilt?
Absolutely. And we have a recommendation 5% forward.
Okay.
And last but not least, because we are doing it here, just think about the ports and think about your joints.
Yes, how far away?
Do you? Yes, absolutely. And I'm talking especially about this lateral port.
Yep.
And I will make it now with a laparoscopic approach. Do you agree when I'm saying, when I'm the arm base and I'm very far away, I need to stretch my arm to reach the lateral port?
Yes.
But if I'm going more into the left, my elbow joint is going to better smooth and I have more reach.
Yes.
For this, we need to put it on the left side, right?
Okay.
Okay, very good. So, and we have 5 degrees as a recommendation. This is a preclinical measurement in that case. We're at the stage that we're so happy to explore, to find out what the system is already to do more. So we're figuring it out. But as a reference point, we go forward 5%. You see the arm base is moving. It's more than, so approximately, yeah. So we don't need to be like 5.0 even when I have done it. And now we go to the left 5%, that we have a very good approach and no extended elbow joints. Okay, this is the nice approach, which is taken within very, very quickly. So I had 2 nurses yesterday. I directly have the same explanation and they could implement it because they are laparoscopically and robotic experience. So they directly could understand it. Once we have done it, we say, okay, now we're handing over the power from here to there. And for this, we take the mode, prepare the arm, press it, again, enable button, and you see that the arms are preparing towards the anatomy in front of the trocars, yes, and the endoscope arm is ready to use for the pivot setting. Good. Once I have done this, I accept the position, but I need to double check. If you just come around, because I'm telling the system, I'm changing the power or the influence from here to there, and I say, okay, we're ready. Here it's done. And now we have,
hand over.
Yes, hand over. So as a double check, a safety feature. So here is the same. Now we start with the endoscope, and should we do the pivot point setting?
Yep.
Okay, fantastic. Check the camera. Yes, yes. Yeah, so, and now I told you when we move the arm, it's going up, left, right. When I use the mode switch button, it's going, and I need to attach the system. So this one has a weight approximately about 200. Sorry guys, 280. And if you just feel the waves, so you just have a resistance, but it's a smooth attachment because you just attach it if you just respect the rails and the railway. So you know absolutely in that case that it's connected. Double check, I hear my audio signal, visual confirmation, recognized. And now I do the two-step pivot point setting, what we did. So for first at the surface, second at the muscle fascia. Here we do a double pivot point pressing because the skin and the fascia is very close together.
Yep.
So once, if we don't have it, we orientate at the port depth and autonomous index of the patient. So for first, I will show, okay, good. What is my approach? It's 30 down. Okay, my target anatomy, I would like to put it in space. It's not really aligned, so I move a lateral movement that I have a very good approach. And I would like to go a little bit more in the angulation because you have a 30 down approach and then you turn it in 30 up so that it matches. But this is something what is okay. So, good. And then I slightly coming to the port placement and almost touch the port surface. So slightly. And press once, press two. And you see now there is a 0, as I told you, the 0 centimeters because of the skinny tissue. Okay, and now I'm talking about the adjustment button because I promised you this button will be definitely explained. Okay, this is already measured. So the central endoscope has measured the pivot point. But these arms, I don't want to adjust them manually and put them into space. I just say, come on, I press the adjustment button and according to the calculation of my pivot point setting, all the arms are going towards the anatomy and approximately in the same area where the trocars are lying.
Got it.
Absolutely. So now I'm attaching it again because I say, okay, it's inside. Yeah. Waiting for the recognition. Go inside. Here is the second measured pivot point setting. So I did it very, very quickly. So I put it here at this space.
How do you know it's there?
So it realized because it has 0, it was 0 centimeter, so it's on the surface of the skin. So because of this thin area, right? Okay, you can switch on the light. Oh, okay, if it's ready, but it's okay. It's a nice light texture that we have transparent. So good panorama view, and I always start with the first one, which is next, but it's like a dedication or so. I wouldn't start with this one because this one is confusing. So because for first, when you do a pivot point setting, it measures the distance between these bolts. This could be 20 centimeters or something. So I always start to do one step after another. The vulnerable place on the surface of the skin of the patient, and one inside on the muscle fascia, inside the patient. So these are these two pivot measurements where you just have the pressure points. So how do we do this? Well, actually nobody likes to do it with this kind of stuff which is sharp and peak. For this we have our pivot pointer. The pivot pointer can be mounted and easily like you did it before with the Maryland. It is atraumatic, so we can just touch it here. So we just need to attach it a little bit in a distance. So we just held it, waiting. Instrument is being attached. Pivot pointer is recognized. Yeah. So then we approach. For first, we see, okay, where do we want to go? So this is our target. And I always say, here is left, right, here is median. I just put this port like this. And then I just go and mimic the port, like in this angulation. So you can change with the mode switch indicator, you can change the angulation, from a bigger angle or more lateral angle, or you can go up, down, left, and right. So let us just say, okay, good. I'm doing this approach with not such an angulation. Okay, good. And we go up. So you can go inside, touch the surface with the pivot pointer, press the first step. Yes?
Okay, so that's the skin setting.
This is the skin setting. According to the thickness of the dome, yes, I will press the next one because it's it's not a thing. But if the patient has a high fat tissue, you need to put the board inside, and then you measure the steps. It looking here outside, and then you put it inside, and it depends on the body mass index at how you go into the depth. And then you have this second pivot point. Between these pivot point settings, the fulcrum is measured. Yeah, and everything is calculated regarding the pressure points. So as I promised you, just look here. Here's a measurement of 9.9. This is absolutely recommendable because it's within our recommended distance. So you see here, because the dome is so thin, it's 0 centimeter. But normally you would have here 8 or 6 centimeters or 4 centimeters, depending on the body mass index alterations. Yeah. So this is the pivot point measurement. Yeah. Good. So this one is there, and then I do, and it's all your preference. You can now attach your instrument and put it into space, but I liked for first to do my pivot setting. Then I have done this topic, and then I attach the instrument.
Okay.
Yes. So here again, the same procedure, connecting. I put this one a little bit away, that I have more working space. Looking inside, trocar distance, just like working zone like this. And you see, I can just approach it from everywhere in that case where it's comfortable. So go here, a little bit more angulation, and then come closer. So where you can just go there. So, okay, and press. So 10.1, remove it. And last but not least, our sub hand. So where you just would like to do the retraction or to do the drop. So here connecting even with the, so once you are experienced even with the left hand, although I'm a right-handed. So dropping the bladder, putting it here in this direction, so median, and connecting it like this. So I put it here a little bit more laterally. So fantastic. Going down, approaching, coming closer. You can do these little steps if you want to be very, very precise. And it's done. So now we adjust the instruments. So the instrument adjustment, let us just pretend that we need the Maryland inside. Just connect it. Hear the sound, confirm. Fantastic. Now we need to go inside. That doesn't mean, by the way, this blinking doesn't mean the guide to change because we didn't exchange something. So now this is the step where I inserted it and at the surface inside the trocar it will stop. This is the second measured pivot point, right? So you hear it directly, so it's at this stage. Yeah, so I will leave it like this in the trocar and afterwards, so let us just do the next one step by step, connecting, attaching, waiting. So you have two different types of adjusting your instrument. I'm the one, and I'm saying, let's do it manually. So this is something what is really, really nice in that case, that I can just follow also the endoscope, you know. So this is the good thing from the point of view of the 30 down, 30 up. So if I'm still having two needle holder always the same, just clap on it. If it's vibrating, you directly know, okay, just for security reasons. Yeah. So I also just put it into space. And so here going inside. So by the way, it's an laparoscopic approach. When you use the joystick up, it goes down like an laparoscopic approach, just to let you know. But you already did it consciously. So the next thing, I prefer always to use the both instruments, you know, so that I have two on one side, that I can just do the right setting. So here, a little bit more laterally and a little bit more up. So, and last but not least, we have our wonderful Maryland. So on the other side, not inside. So we can just go more into the depth. So I always just do not completely the approach that it's over the target, because I like to put it in space that I can see my instrument for security reasons. And then I do the precise approach with this fantastic buttons. Because you know, so manually everything can happen in that case. So I like to have a space, a very good space for here. So go inside, and now I'm here. Just look here, I lost view of my instrument. I love these kinds of steps. So you see, 3 is on 12 o'clock, so I even don't need to search for it. I know it. And now I'm going more into the depth because I see a fantastic 3D view. Go inside, a little bit more space. And last but not least, my reach up.
Okay.
Wait. I have my retractor, which is just inside. Good. So, and it's ready for use for surgical mode. So, yeah, storage position in the lowest profile, so you can raise it until 1.8, and we just need to move it easily. Yeah.
Okay, so it's a manual movement.
It's a manual. These are the only 2 things at the surgery cockpit which are manual: to move and to adjust the 3D viewer. You're right. So once you have found your final position, put the lever.
Yeah, people ask me that. Can you get the 3D out?
Yeah.
That's interesting. The annotation.
The annotation, yes, absolutely. And let's start down with the foot unit. So the foot unit is structured. I will tell you the differences of the Da Vinci and of the Hinotori system. You need to tap it, really tap it, and not to tap it from the side. You need to push with or to step on it. Okay. You use this swap pedal to drive the sub hand with your actively pressed hand.
Okay.
So right sub hand and right operating hand. I have a white frame where my foot is hovering. Left, the clutch and scope. This is a pop-up icon, which is also giving you guidance that you know, okay, my foot is now there. Or it's on the right side when I'm approaching some, on the left side when I'm approaching some electrosurgical pedals, yes? Okay, so once not activated, you have a white frame. Activated, you have a white button, right? Okay, let's start with the scope pedal. You see the scope pedal? The scope pedal is just activated, and you see the horizon indicator. That means you can tap in, so you can zoom in, zoom out, and you can, like you're driving a car, rotate your horizon indicator. Okay. Makes it very easy. You see the icon above where the endoscope, all arms are above. So, Marcus, could you do me a favor and just put arm free out of view of the endoscope? Put it laterally. This one? Yes, it should be laterally. Yes. And now you see a gray arrow. The gray arrow refers exactly at the clock where your sub-hand or your retractor is done. So once if you just drop the bladder and keep it dropped and you work on the prostate and have no vision, it will be directly displayed at 5, 4, or 6 o'clock. Right?
Very interesting.
So very secure. So you have the clutch pedal. The clutch pedal is activating. So you see in the left, the clutch pedal is active, and it disengaged your actively worked instruments, which you have engaged before. Clutch pedal for suturing. We have a clutch button too, but later more. So good. Then we have the base unit. Base unit with communication, where you just hear your stuff. You can hear it also here, but you can hear it here and the sound. On the other side, you saw the connection terminal, so everything. So good. Now we're coming to the arm unit, to the armrest unit to be exactly. The armrest unit to raise and lower your profile that you can work with. Already known buttons, which I already just showed you. So you can do the emergency stop, reset it. Okay, and here is the adjustment. So I have presets and I want to have my presets. Yes, please. So I press and hold. So trainer Sebastian, it's me. Everything is just adjusting. The foot unit is coming out and my armrest is just adjusting this. So you can do the presets for 100 adjustments. So it's university hospital style that enough surgeons can adjust their own adjustment. So good. Once we have done this, we are on the home screen. So you see, here is the surgeon cockpit. You see the armrest, the foot unit adjustment. You will do it afterwards on your own. And the scaling. The scaling, 3 to 1, you know, if I do movements of 3 here, and 1 will be answered. So this is something what brings a little delay inside the movements. But at the beginning, I always start with surgeons who are just coming to the system, getting known with 3 to 1, 2 to 1, 2 centimeters here, 1 centimeter there. So it's always moderate. So this is more the most default adjustment. And for quicker movement, 1.5 to 1, it's almost a response of the performance inside the armrest.
Okay.
Moving the flexure or bowels mobilization, yeah, just to release the peritoneum from a bigger space. Pivot distance, it was this one what I showed you. So again, you can display it, you can just exclude it. By the way, many adjustments you can just put it out of the screen if you don't need it when you're familiar with this. Okay, here, the time measurement for ischemia time, for partial nephrectomy, for example. If you want to start the time, you can see it on the screen and you can definitely, so here you can start it in that case, right? So that's, okay, stop. So the next, what I told you is these with the different layouts. So you can just double the screen, you can triple the screen or triple it on a different style if you just connect some peripheral devices in that case. Brightness, contrast, I won't refer to this because this is a general adjustment. Okay. Scope, you can turn the scope from 30 up to 30 down adjustment, yeah? So you can do it in that case. Yep. So it turns directly, but there is an easier way without interrupting your surgical flow, that you keep your head in the headrest. Because when you're just moving it inside outside to adjust this one, it's you have interrupt your surgical flow, but later more. Okay, so here the same adjustment like connected to the socket. This is the error history mode, so that means once I just put the emergency button and I resetted it again. So the next thing is, let's go here to the adjustment. There are some appearance thing where I wanted to get brightness timer. This is here with the timer. I didn't switch it on. Now you can see it for the ischemia time. So it was only here on the display, but there you can, for example, start it. So here are some general adjustment which are not so important. You can do the bar. You can do the instrument bar. You can make it bigger or smaller. For training purposes, I like to do it bigger. So view display. So this is what I'm saying is where we can switch off all these kind of adjustments. So, for example, this is a hand controller indicator on both sides. It gives you orientation of your rotational movement.
Okay.
Especially when you know and try to do suturing, that you say, okay, where is my instrument, in which position is it? Is it in neutral position? Then it's in the middle. And when I have a white bar, that means I can rotate it 260 degrees in the left and 260 degrees on the right. If it's not aligned with my hand controller, there will be a gap. And as you know, when there is a gap, a movement is not so smooth and it is restricted. So you need to put it in neutral position, then you have your bar. But we have a guidance in that case before. So if you just face a rotation, on the end, I will press the clutch pedal and I have a hand controller action. The system is already telling you, hey, please move your instrument clockwise to the right position. You see here, in that case, if I'm going in the opposite, it says 360 degrees. So I'm going backwards, yes. And now you see this little gap. So just one sec. I try to put the instrument in a good position. Very good. So like this. So put it here. And we do it again. You see it, and now it's in neutral position, aligned, and I have my full rotation mode. So these kind of steps can be erased. Just look there, and now it's gone, and it's gone. So these advisements can be just excluded if you say, okay, it's too much information for me because I'm already familiar with this. Yes? Yeah, and here just instrument position. This means with the gray arrow. So if we don't see the... Could you exclude, Takashi, just again? Could you exclude, go laterally with arm 4, laterally that it's not visible. Go to the right. No, not inside, outside, and yes, thank you so much. So again, and now we're going here, and this, for example, can be also erased in that case, and then it's gone. So all these adjustments can be just excluded for an experienced surgeon.
Yep.
But for training purposes, it's a really nice thing to tell the surgeon, okay, where am I? How much rotation do I have? Where is my rotation limited? Because in other devices, and you know it also, Steve, we need to pay attention for this alignment of,
Yes.
of the hand controller, yeah, of the joystick or something. And here you directly get the information, hey, there's a misalignment, please correct it. It's an adjustment which it's going not to be changed because the line by line 3D.
Do you know, is it HD or 4K?
It's 4K. It's 4K. Definitely 4K. It's a Rubina 4K 3D ICG.
Okay.
So, yeah, it's one of the newer one because the pre-last of the Rubina was
HD.
yes, absolutely HD3. Yeah, absolutely.
Okay, let me
So,
zoom in on that.
Yeah. Yes, please. I can wait a minute.
Mr. Storts.
Give you a better insight. So here,
There we go.
there you have it.
4K
Mhm.
3D, very nice.
And ICGs. Yes. System, volume, so general settings, yeah. And this device information about, yeah, what kind of model name and software version. So everything is just...
Does the system have an app, a companion app?
Not yet. Not
Okay.
yet. So this is something as a trainer is definitely so on our vision.
Okay.
Yes. Yes. So you mean like versus app and...
Like a Connect or Insights
yeah.
or whatever.
Yeah.
Yep. Okay.
Okay, good. So good. This was the adjustment. The 3D viewer, just to emphasize, it was we already had it when the Da Vinci 5 before it was released. So we had the manual adjustment where we had to put the levers here, the latches, to adjust the view of the surgeon. And I always refer, please try to avoid to go in a very famous adjustment. Try to use an horizontal view where you have a very good ergonomic position where the back and the neck is not strained, overstrained. So you have a manual, you can twist it inside, you can retrieve it, you can put it inside. It depends on your adjustment. So the levels are manually just, you can change it. The headrest. I strongly recommend you use the headrest because sometimes it can happen when you're not using the headrest sufficiently. It could be like not blurry because it's very good view, but if something is not so clear,
Yep.
put your forehead into the headrest. Yeah, here you have the sensors too, which
Yep.
is engaging and disengaging. You
Yep.
see a guided workflow. It directly refers use matching grips to activate your instruments. So speaker and microphone to communicate. Inside the view, Sony technique. This is why it's so clear. And a 16:9 instead of 4. Wait a minute, I will help you. So now you should see it. Yeah. A 16:9 view screen instead of 4:3. This means when I have Da Vinci users, I always say, okay, please, for first, be ready for a panorama optic. Yeah, so the nice high view with the short, the short ending, it's here the opposite, really nice panorama and a very, very clear vision. So these are the only two things which you do manually. The other things are just pressing button, using home screen, touch screens, and joysticks. So, Steve, I think the stage is you. Yes, very good. Very good. And now you see on the screen there is information. Use matching grips. Relax the grip. Absolutely. Just close your jaws. Make some rotational movement. And as usual, use your instruments. Just look at the hand in control indicator of the instruments is level 2. So we start with this one. Okay. So do some, yes, absolutely. Do some endoscope exercises that you just get away with and get in touch with this experience. You know, it's a mechanical zooming, so the camera is turning inside and outside. So driving a car, if you want to do a rotation and horizon indicator change, yes. I will be now reactive and not making too much blah blah now. And if you've got questions, ask me. Yes.
So if I want to
Yeah.
take these things in.
Yeah, okay. So, yeah, okay. So, if you want to take the instruments in, yes. Use your clutch pedal, the small one here.
Okay.
Yes, and come back with your instruments and go more into the depth. Release the clutch pedal and go more into the depth if you need.
Talk about working out.
So here you can see the HF Series 2. This makes a difference because the sterilization lives. Everyone I told you is 20 lives except the monopolar scissors. So we have the needle holder for normal needles and for smooth suturing. Then we have, and then we have the white needle holder. The white needle holder is more designed for V-logs, bigger needles to handle it. So in that case, so also 20 lives. So Crossy Grasper, it's a curved fenestrated for blunt dissection and standard retracting or manipulating. So we have the universal grasping. You already recognize it.
Yeah.
It's the Cartier style. Yeah. So also 20 lives. And here's the versatile grasper. So the versatile grasper you can do and manipulate tissue, but it has a 3 times more grasping force.
Okay, so that's the high force grasp.
Yes, absolutely. So you're willing to use an ultrasound probe to hold it here and to do some ultrasound diagnostic. Monopolar scissor. Fantastic. So 10 lives. And I will show you something. There's a difference with the isolation cover. Do you remember, Steve?
I do remember isolation covers. Yeah, lots of fun with those.
There was much training, practice needed. Oh, it's single use as well. So, because this other one was destroyed. So, I love it so much because this is so easy to handle. So you just have it and you just squeeze it on side and it's done. And it's already done.
Yeah,
So-
very nice.
And you can just remove it easily. So you can use this one or you can use a gauze in that case. And it's done also.
Perfect.
Good. Yeah. So, sorry, I was nervous. So good. Okay, 10 lives. So bipolar Maryland. Yeah. So many surgeons are just reporting that the grasping force is very impressive. So 20 lives.
Which generator do you use?
So we use the Autocon. We have a strong collaboration with Karl Storz. So the vision unit is integrated into our Karl Storz monitor tower. So it's the Autocon 400.
Okay.
So the bipolar fenestrated also. Yeah, if somebody don't like this peak.
Yep.
Maryland. So, and now we have the clip appliers.
Oh.
So the standard one, which are already known as hammer look. So
Yep.
in size M, L, and
that's
L.
with WEC.
Absolutely. We're working close together with WEC. So it's easily to adjust 60 lives.
Okay.
And the little one, which is also from REC, but it's metal, it's the Horizon in size in size small. Yeah, also 160 lives. So this is our portfolio from... So, okay. So the HF Series 2 are the news released with a longer sterilization life, just to let you know. We will just say there is no button or something where we have to press. Surgeon is saying, we're finished, we're finished. So we move linearly all the instruments. So yeah, we just put it out, yeah, in the linear movement. That means now endoscope control because the guide to change function.
It's interesting that the arms reset alone.
Absolutely, this is a very good step. So this endoscope, would you take it for me and switch it off on the other side, please? So now everything is detached, disconnected. And now we're going to the screen because I told you here is the checking mode. Mounting completed. This signalizes the system, oh, nothing is in the patient. So we can do in the mode bar. And he asked, because I actively want to change a position. I say yes. Yeah. And then a signal is coming. We need to raise the arm base. It goes automatic up, yeah, not to impact with the patient or with anyone else. It goes backwards, so no worries. I just adjusted it very low, so the feeling is not interrupting. Yes, it goes into a V position. You see the V? This is related because the camera needs to have a clear view.
Okay.
Okay, and now you can just look on the screen. We have here the vision of the camera, which is really nice and really clear.
Yeah, that's good.
So for the rollout, there is no guidance because we just need to go backward. So I press the button. Oh yeah, you will do it afterwards. So go afterwards. So this is the speed of 2, by the way. It's for training purposes. I can raise the speed to 5. That's very quick, by the way.
And if it encounters a cable or a collision, or does it stop?
Yeah. So at this point, it won't stop because we always recommend to do it with 2 persons.
Yes.
Yeah. So the
Guided.
circulating and the steering nurse when she's shown already unsterile. So as a guidance, absolutely. So even the roll in, we definitely recommend it because it's a very big footprint in that case. Yes. So the next thing is, theoretically, if it would be a low anterior resection, I would turn from the transversal to the longitudinal approach and do the anatomy and re-roll in.
Okay. Well,
A quick step, and then it turns into this longitudinal approach or transversal approach, and I can just continue. But I say, no, God, we need. Oh yeah, you can put it here inside, into the black one on the left.
Sorry.
Just put it inside. Yeah. Yeah, and then just switch off the light at the touch screen. Thank you so much. So, but we say, no, surgery is over. We want to remove the drapes. I will show you the draping also, if you want to, Steve.
yeah.
So, just take care. So now it's putting it together and do the arm base is frontal facing. Could you do the table? Could you remove the table a little bit that it's not in the way? Yes. So it's frontal. It shows you frontal. So for these purposes, it just frontally shows you the arm controller, and I will show you how this draping is looking like. So the height, I can raise or lower the height without discrimination nurses, but I have very, very small nurses colleagues. So you can just adapt it to their needs, and you can, if you wanted to drape, you can already adjust the spread. I will just remove it, disconnect, remove it for first pulling and disconnect. So it's a really quick step. So let us, and I show you the undraping afterwards. So disconnect, again, single use. So I just do it like the banana technique. So everything, if something is contaminated, I protect myself and everything is safe. Very quickly done. So then you see the check mark is gone. And I tell the system, undraping, remove drape, completed. Then I get my legend of all used instruments. It's not gone when we press a button, Steve, so it's really documented.
Okay.
Current of the surgery, pre-surgery, and the pre-last surgery. For 3 surgeries, you can see what kind of type equipment you used, the serial number, and the sterilization time used.
Got it.
Yes? Okay, good. So, and then you can close it consciously. Okay, now we go into the storing position. The good one, it's literally folding like a Japanese origami.
Okay, let's see the.
So you will see it. Okay, pressing the joystick, it just turns and it's reducing the footprint to its maximum. So it will be now, it will be an A shape. Yeah. So it will be an A shape and it will put the arms, the operation arms, between the position. And I consciously chose a high adjustment. Now you see the position as very high. And you say, okay, let's lower the position, then folding Japanese origami inside to a 0 level. Okay. And now I say I accept the position, storage position completed. I would put everything into storage position. So let's pretend this one is also, in that case, everything is just lowered and put inside. Good. So you hear the sound, the confirmation sound, it just did a different noise. That if you want to have it lower, accepted the technical advisement. It's in the lowest profile, it's in the lowest profile, and then I can go, it doesn't matter where I go to the operation unit, I can go to the vision unit, or I can go to the surgeon cockpit. Okay. Everywhere you can just power it off. You press longer than 3 seconds, the system is asking you, would you like to interrupt the shutdown, cancel the shutdown? We say no. And then we're just waiting. Good. And it's shutting down everything. You see, now you have a orange background light. That means it's in a standby mode, but it's still connected to the power. Also referring to the both lights of the wheel brake, which is activated, and internal battery. So as I told you, we have a collaboration with our car Storz company. The vision unit is integrated into the tower, so I just switch it off here. Everything is switched off, and you see if the power is disconnected, you have a gray background.
Okay.
And this is a good thing for troubleshooting if it's still gray and you can't stop it. For example, you want to do a power up of all systems. It's a short press. It will directly refer, hey, troubleshoot one of the device which is not orange.
Orange. Okay.
Yes.
Very good. So, thank you very much for hosting me this morning.
Yeah.
So, explain who you are and what you do.
So, first of all, I'm Tetsuya Nakanishi, General Manager of Medicaroid Europe. We are working on CE mark process in Europe. We are bringing such a kind of excellent Japanese quality surgical robot system very soon to be on the market here in Europe.
Perfect. And, so at the moment, if people want to get their hands on, because I have a lot of people ask me, how do I get a try of Hinotori?
Yeah, try Hinotori. We had a 3 sites in Europe, in Düsseldorf, Medicaroid Europe office headquarters. And we had one system in OC Academy in Belgium, and one more system in ILCAD, France. If you come to ILCAD, Düsseldorf or OC Academy, you can try Hinotori system anytime.
Perfect. And can you give me a little bit of an update where you are clinically in Japan? Because it's already in Japan, correct?
Yes. Now we had experience in Japan, Malaysia, and Singapore. And we had an entire more than 100 system installation with 13,000 case done. And the specialty urology, gynecology, general surgery, including upper GI, lower GI, and HPV. Even thoracic, we had a system. We had experience, and expanding a lot, and increasing a lot.
So fantastic system. A lot of people are asking, when is it going to be available in Europe?
Yes, this is really not our hand and not quite really hand, but I can say beginning of next year you can touch Hinotori with a real-life clinical.
Yeah. And can people get in touch with somebody now if they want to talk about potentially getting a system in the future? Who would they reach out to?
If sure, you can directly contact me or our commercial director Javier Bronte, and in Italy area Marco Zambonini. You can contact our member, and you can reach out through LinkedIn and throughout email and throughout in IRCAD OC Düsseldorf anytime.
Perfect. Thank you. Great to be here with you today.
Nice to see you again, Steve.
So look, you've been involved in laparoscopy for probably as long as I have, and you've seen the whole change from open to laparoscopic and the move to robotic, and you've been involved with robotic systems.
Yeah.
Tell me a little bit about what's attracted you to Medicaroid and Hinotori.
Yeah, thank you, Steve. I believe that really with robotics, we are where we were probably with laparoscopy 30 years ago. It represents, of course, the future. I believe that Hinotori, because also of the Kawasaki technology, is going to be a step forward, and the precision and the experience of a Kawasaki in robotic can really bring something different and an alternative to what has been used in the last 25 years. Is not a clone or something else, but is a robot that is bringing some different things to the table and some innovation in some area.
And it's incredibly high quality as well, by the way.
Absolutely, yeah.
So if people want to get hold of you, get hold of on the system, how can they do that?
As Tetsuya said, we have different sites. We have two different training centers in Europe, IRCAD and ORSI. And of course, through me or through Medicaroid in LinkedIn, you can easily find us. We can discuss about the possibility to have a try, what we call a test drive. Today, we are here at the Gemelli Training Center in occasion of the SICO Congress, and we're going to give the possibility to everyone who's coming to our booth to have a test drive for some minutes with us.
Well, I think they'll enjoy the test drive. I think they'll find it quite great, and hopefully at this video they'll get to see some of the quality of this product.
Absolutely, and thank you for coming. It was really a pleasure to having this couple of hours with you.
Thanks.
Thank you very much.
Thank you.
Bye.
Great. So I hope you found that fascinating. Really good deep dive. Thank you to Tetsui, to Marco, and to Sebastian for taking me through that in such great details. So what do I think of it? So the first thing that you'll notice with that system is amazing quality, and there's just no doubt about it. It's really good Japanese quality, and coming out of the Kawasaki house, you can't expect anything else. And really in Japanese products, there's always just amazing quality, and the instruments felt really, really good. And they're already at 20 uses, and you can see that with the HF2 series that they're at 20 uses. Very nice, small, compact. We'll get into instruments in a minute. I'll take through everything that I noticed on the system. So let's talk first of all. So the good thing is it's a Japanese quality. It's an amazing quality. For me, one of the difficulties I had with the whole system, and again, it's a little bit like if I said to you, describe to me driving a car, it would be really, really laborious for you to go through every step of driving the car. So it can feel a little bit, just a little bit long-winded in terms of that. But that's Sebastian explained to me in great details, as if he was doing a full demo for a nursing team or for a surgical team. So I can assure you it is much faster than it feels when you're doing this in a video. But it is still, for me, very engineering driven. I think there's been too much engineering put into this. There's too many presses, buttons, menus, tick boxes, steps that you have to do. There's too many buttons on the arms, forwards, backwards, mode, jog, shuttle. Makes it very nice to use, by the way. The way that you can move the arms around with the small joystick, etc., and the different modes. But it is very, very complex from that point of view. So let me talk about the individual pieces. So they're my two things. It's great quality, but it can feel a little bit overwhelming and a little bit complex. And I would say to the Hinotori engineers, make it simple in the future, make it as simple as possible and as user-friendly as possible for the users, reduce some of the steps. So let's talk about, first of all, about the bedside unit. The bedside unit, the boom itself is actually quite compact and quite small compared to something like an XI. So I was actually quite impressed with that. And the arms are gorgeous. You know, they're really thin, 8 degrees of freedom, really helps you to position them in a way that you can avoid clash. The Z rails are amazingly small and compact, and the drive units for the instruments are some of the best that I've seen in terms of quality, size, compactness. And just the engineering that's behind it is really, really nice and clever. Talk about the elephant in the room. The base unit, footprint-wise, it's about the same as an XI. You know, I sat and measured it and went through it. It's about the same as an XI. But it's really tall, big, and heavy, and it just feels massive in the room. And you know, you drive it with almost like a motorbike steering thing, and it's got 3 wheels, so it drives really, really well. It actually was easy to drive forwards and backwards, and you can change the speed that you move it around at. But it just feels massive in the room. It feels like it takes up a huge piece of the operating room. And again, in the future, I would wonder whether they could make that a little bit smaller. It is also, for me, you know, the whole way that the thing comes out and packs away and goes into a V is really nice. You know, it's Japanese origami at its best. But it just feels slow and laborious the way the whole thing unfolds and comes out and then switches around to the patient orientation. Clever, lots of modes in there for whether you're going down one way in the pelvis or up into the chest or whichever way that you're using it. It's all very, very clever, but it feels a little bit of an over-engineering to me. But it is gorgeous the way it does it. It's super controlled. You know, you have that one joystick system to move it around where you want it. I did like the visual system on the arm that looks down onto the patient. That was nice for the docking and bringing the system in. It gave you some really nice accuracy. And then what I really did like was the fact that then from the boom, you can then orientate the boom in 2 or 3 different ways. So there's sort of like a pitch and there's an angulation, so that you can make sure that the arms are approaching the patient at the best angle that they can. And yeah, that was interesting. I found the way that they do the pivot point excessively engineering heavy. The fact that you put on a pivot point pointer and you point to the skin and then it works out the depth is really nice, but it feels engineering heavy. And I wonder whether some teams, you know, it's going to take them a little while to get used to doing that. It is clever the way that it does it. But I've seen other systems like CMR and I've seen a Census with their Luna that does automatic pivot pointing. And I wonder whether their engineers could just do a little bit more work on that. However, with their system, it does give you good visual display, gives you the trocar distances between them so that you always make sure that you're optimal distances. You're not going to be in so much clash. And again, the arms are very slim and small and you can get them very close together. So that was really nice. So I think that overall, it's nice, but it's too engineering heavy for me. And I think that that's going to cause some teams in some hospitals to feel a bit, that feels like it's quite an awkward way to set it up. But it is nice and it's clever the way that it does it. In terms of the ports are very nice. Let's talk about the instruments that attach onto the arms. Great range of instruments, and they've already got some clip appliers and stuff. There are advanced energies and all those things coming down the pipe. The instruments are a beautiful build quality. You have to feel them. I mean, it's typical Japanese instrumentation. The quality of Kawasaki behind them. They just feel really, really nice, and they don't feel bulky and they don't feel heavy at all. And yeah, full degrees of movement in the wrists, in the endo wrists. Very, very good. And yeah, very impressed with their instrumentation. I thought it was really superb. And the connectors that come onto the instrumentation were very nice as well. Visualization system, Rubina 4K, and they do use the full 4K. And I'll talk a little bit about that when I talk about the console. Yeah, very, very nice. And the fact that you can put that into 3D on the screen, as we saw, is a really, really good. That's something that gets asked by bedside teams and nursing teams all the time. They just put the glasses on and you see really good 3D up on the screen. So whoever's doing bedside has the full advantage of the 3D scope all the way there. It's Rubina, so it's really good quality, brilliant image, luminosity, ICG and all the modes for that, really, really good. I like the fact the camera can flip up and down really fast. It does, orientation from 30 degree up and 30 degree down really well, really, really fast, really nice, all from the console. That was nice. Moving over to the console is lovely. The Sony 4K viewer is pretty amazing. And I don't know if you picked up what they talked about in there. So a lot of the viewers in there are like almost like a square kind of 4x3. This is 16:9. So this is a full wide 16:9 in 4K, and the monitor in the eyepiece inside are in 4K. Lovely, really, really good visualization. I think it's probably the best that I've sat on so far in terms of the headpiece and visualization, and it's small and you can get the adjustments exactly where you want it. Really, really easy. You just bring it to your face and you can get your neck really, really comfortable in it. Fine with glasses, fine without glasses. It was just, yeah, I really like that. The controllers are interesting, that you can change the sort of the weight of the controllers, so that how much resistance they give you, the gravity resistance that they give you. That was a nice touch. You can have them super light, or you can add some more weight in there so that it feels like it gives you more control. And that's independent of the scaling. The scaling was in there as well that you're able to do. So with that combination of weight of the controllers and scaling, I felt you could get really brilliant control of the hand controllers. Foot pedal's nice. Some clever software in there showing you where your foot is touching and not touching. Very, if you can use an XI's foot pedals, you'll be able to use this. Very nice. Nice that you can adjust the distance that it goes in and out. So I could get really comfortable on that console. Nice small LCD screen at the bottom, so you can adjust everything from there. But really, just get in, get going. I think it's a really nice console. What I'll notice about that is that it's really clean at the back. Again, go back and look at the piece where I showed the back. The reason why I zoomed in on that is that it's really, really clean. The way that they've done the cabling and all the connectors is super nice. It's really high quality. It's just clear that they've got a lot of industrial design over years and years. And the annotation output was really interesting. You can have a 2D annotation screen so that you can actually write on the screen or draw, or you can do telestration on the screen. Very, very nice. So all in all, console as good as anybody's out there, absolutely no doubt about it. And the quality was beautiful, and the hand grips were really, really nice. And the whole kinematics of the way that it worked. I was told before going in a couple of weeks ago that the kinematics on this are weird because it's not a remote center. Didn't find that at all. It felt exactly as if I was using any other console. The kinematics were really good. Lag was almost zero. It was brilliant lag. Didn't have too much. A little bit of vibration that you get with non-remote center systems, that if you do a launch and a stop of the instrument, you get this kind of movement. That seems to be common on all systems that don't lock onto the trocars as much. But no problem from a stability point of view. It was really good, and I think anyone using this would find it smooth, unless they took it to the extremes like I was doing to provoke the system. I think they'll find it a really smooth and good system. What else would I say on there? Console just really good. Tower, it's got the Hinotori control box in it at the bottom, and then you've got your Storz integration at the top, and they're very well integrated into Storz, and it's a lovely system. They use the Storz electrosurgery, insufflation would be the Storz insufflation, Storz imaging, all very, very good, and all logically works together. And the beautiful big screen that's a 3D screen on the tower is very, very nice, and everything works well. The software works well between it. It's just a very well thought out system, and I really liked it. So if I talk from a technical point of view, I think the bass is still too big on the bedside boom, but the boom itself is not as big as I sort of had in my head that it was much bigger. It's actually more compact than I thought, and it's nice that you can get the angles. Very nice slim arms. I think anyone would appreciate the Kawasaki technology in those arms that are really beautiful. Instruments beautiful, console as good as anybody's, and I think the best viewfinder that I've so far had on the market. So really good system. The question that I asked this to the team from Medicaroid, so what is it that, why would I take this and not another system? So I think in my mind, and this is again just my opinion, it's my own personal opinion, what comes from me is that if you're somebody who's looking for a boom robot, then this should be on your list to try. Absolutely should be on your list to try. I think that some of the benefits you get is you get 20 uses on each instrument, so that's really, really good. I think what you also get, though, is you just get the guarantee of a big, solid Japanese company behind this. Kawasaki is not going anywhere. So if you're getting into a 7-year relationship with this company, it's going to be around in 7 years. It is very good. It's got really good telesurgery as well, which has been proven out in thousands and thousands of cases in Japan. So I don't think you get anything more interesting than something like an XI or a microport or anything. I think you get the same sort of functionality that's in there. What I think you get is you get an alternative. So if you don't want another XI in your hospital, or you don't want to take an XI, you don't want to buy into the Intuitive lifestyle and moat and architecture, and you're saying, we want a different system that's in here, then this should definitely be on your shopping list to look at. It's a really high quality system. Can it do procedures? Absolutely. Does it do them really well? Everything I've seen from the clinical images and the talking with surgeons that have used it, yes, it does it really, really well. Is it a genuine alternative to an XI? Yes. Do I think that it's going to be a cheap alternative? No, I think that you're not going to get such things as a cheap alternative to any robot anywhere. And you shouldn't be thinking that way. You should be thinking, is it going to be roughly the same cost per case, or maybe less per case slightly? But it's not about being cheap. It's about maybe being a bit more frugal than some other systems, maybe. But I think what you really get is you get you can say I've got a different alternative. If you don't like BMWs, you want to buy a Mercedes, there you go. You've got it there. So I think that's what they kind of offer in there. Their training is excellent. Sebastian is one of the best. He was really good at the last company I was at. Their level of support and training and their investment into places like ERCAD is huge. And I think that if you go there as a team, you will know how to come back and use that system. And I think that the system, you will get the most out of the system because of their support and their training and their servicing. They know how to do that as a company. That's the bread and butter of Kawasaki for years and years. So they really know how to do that. And I think that what you're basically getting here with Hinotori is a really good, high quality Japanese alternative to a Da Vinci. And if you're in the market for something that's different and you want to have something that's different, and if you're a university hospital that's looking to be on the podium and be some of the first around Europe as soon as they get their CE mark, and Tetsui mentioned the CE mark, as soon as they get the CE mark, and you want it to be alternative and you want to do the first 300, 400 cases with a different system, brilliant. There's one to go for. So all in all, yeah, I was impressed. I think they need to make it a little bit easier in the future, be less technical, less engineering driven, and more bedside team driven, so that it's just easier and more fluid to use. But a lot of the features are nice in there, and I know they've got a lot of stuff coming for it in the near future. So one to watch, and definitely would seriously think about going and getting a test drive on the Hinotori. Really worth trying it out and having it as a potential high quality alternative to Intuitive, if that's what you're looking for. So I hope you found that review useful, and I hope you now understand the system of Hinotori better. And again, thank you to the team at Medicaroid for doing that for me. It was a whole morning out of their time to do that with me, so I appreciate it a lot, and I'll catch you on the next one.